by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.
It seemed like the crisis that dominated our world was almost gone. Businesses, restaurants, and stadiums opened. Travelers hit the roads and the airports, and the fully vaccinated took off their masks. But then, cases started rising in younger people, those who did not get the vaccine, and even in some who did. And now, hospitals are once again at the breaking point. And just as children go back to school, many more of them are getting sick from COVID. We are here to answer your questions and dispel myths about the virus, about the variants, and about the vaccines. Join us as we hear from the top experts on COVID vaccines, clearing the air, next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome, everyone, to COVID Vaccines Clearing the Air. I'm Olga Villaverde. There is so much misinformation out there, and we are here to get you the facts. Our moderator today is Dr. Michael Zinner. He is the CEO and Chief Medical Director of the Miami Cancer Institute. He was the Clinical Director and Surgeon-in-Chief at Brigham and Women's Hospital, as well as Professor of Surgery at Harvard Medical School for 22 years. Welcome, Dr. Zinner.
Thank you, Olga. None of us in healthcare today have ever experienced the kind of challenges we faced for the past year and a half. With over 600,000 American lives lost to this devastating disease, we all anxiously awaited a vaccine or treatments for a virus we had never seen before. The government and healthcare industry's ability to rapidly develop solutions, including a novel set of vaccines, far exceeded any prior pandemic response in human history. And in the spring and early summer of this year, as the infection numbers began to fall, we all breathed a tremendous sigh of relief. We relaxed our mask wearing, went back to social gatherings, and thought we saw an end to this misery. And the rate of infections dropped a lot, but we were wrong. The virus changed, and it is now not at all the same bad actor we fought last year. This new virus is worse than what we had before, and now it's a new ball game. No wonder people are confused and angry. We thought this COVID nightmare was coming to an end. It has not. And with so much misinformation out there, we felt it was necessary to clear the air and listen to clinicians and scientists answer your questions. So, Olga, let me turn this back to you.
Thank you, Dr. Zinner. We have a wonderful panel of experts. Let me start first. From the Brookings Institution is primary care physician Dr. Kavita Patel. Welcome. From Emory University School of Medicine, Associate Dean Dr. Carlos Del Rio is here as well. Welcome, doctor. And Dr. Geeta Nayyar. She's a rheumatologist and an associate professor of medicine from the University of Miami. Welcome to all of you. We are delighted to have you this evening. Dr. Zinner?
Thank you, Olga. We also have Dr. Anthony Fauci, the nation's top infectious disease expert and director of the National Institute of Allergy and Infectious Disease. I spoke with him earlier and asked him a number of questions regarding the Delta variant and the fact that we are actually dealing with a new virus. Let's hear what he has to say. Delta variant has thrown us a curveball. CDC recommendations are changing with respect to masking indoors and outdoors, and now we've got breakthrough infections. Can you help us understand some of these Delta changes?
Well, yeah. Well, Delta is really a very formidable virus in that it has the capability of transmitting much more efficiently than the original prototype virus that we had been confronted with early on in the outbreak. So you're really dealing with, obviously you're still dealing with SARS-CoV-2, but you're dealing with a much more formidable virus in the sense of transmissibility. Also, it has the very interesting capability that when you get infected, the amount of virus that's in your nasopharynx with the Delta variant compared to the amount of virus that would be in the nasopharynx of the other variants that we had faced previously is up to 1,000 times more, which really is the mechanistic explanation of why it so readily transmits. You bring up the point of breakthrough infections. A breakthrough infection is something that is to be expected because no vaccine is 100% protective. And the vaccine trials that were originally done, the one that we're familiar with, for example, with the mRNA, showing that they were 94 to 95% protective, that was protective against clinically apparent disease and not necessarily against infection, which for the most part, even if you had a subclinical infection that didn't make you symptomatic at all, there was very little chance previously with the other variants that you might transmit the infection if you were vaccinated and had a breakthrough infection because the level of virus would be so low in your nasopharynx. But this virus is so efficient in transmitting that even if you are a vaccinated person and you get an infection, even if you have no symptoms at all or minimal symptoms, you still have the possibility that you may transmit it to someone else, even though you don't have very many symptoms. So that adds an extra important wrinkle in this, which is the reason for the modification of the CDC guidelines about wearing of masks, because the transmissibility in an indoor setting, particularly in a place like Florida that has a high level of virus transmission, that the recommendation is to wear a mask if you are an indoor public setting, including in schools, because the transmissibility is at such a high level of this virus. It sounds like things change with regard to recommendations. That's only because the virus itself is changing.
You know, at this point, I'd like to go around the panel and get everyone's thoughts. So, Dr. Del Rio, let me start with you.
Well, Mike, all I can say is this virus has humbled all of us. And I think what we've learned is that it's very hard to know what's going to happen next. And I almost feel sometimes like I tell people I feel like I'm going down a river with rapids in a canoe, and you're going from one place to another, and you're just trying to stay afloat. We made a lot of progress. We know a lot of things, but Dr. Fauci is absolutely right. Delta is formidable, is highly contagious, and I remind people, if you're vaccinated, you're okay. You may get infected, but you're not going to get sick. You're likely not going to die or end up in the hospital. But if you're not vaccinated, you're in trouble. Delta will find you. And believe me, if you get sick with Delta, you may end up being one of the thousands of people that we currently have in hospitals across the United States.
Thank you, Carlos. And now Dr. Patel.
Yeah, thanks, Dr. Zinner. I couldn't agree more with Dr. Del Rio, but I just want to add some points brought on by Dr. Fauci. So number one, this is a fluid situation. And I think just the evidence we have is what's been happening over the last 7 to 10 days around third doses, boosters. And number two, it's okay if you're confused and if you're troubled by headlines, because I think all of us, to Dr. Del Rio's point, not only are we humbled, but we've never had kind of science on display. I've never seen so many people talk to me about preprint publications or trying to understand how to compare effectiveness or efficacy. So this is a world stage unlike no other, one that I certainly didn't want. I don't think any of us want. The third point really has to kind of drive home to the Floridians, to my home state of Texas, and to several other states. We are at a critical juncture right now because of this variant. To Dr. Fauci's point, we're not asking people to wear masks indoors because the vaccines don't work, but we're trying to create kind of my way of thinking is a wall of immunity to protect those who cannot protect themselves, those who are not eligible for vaccinations. And I'm sure we'll get into this more with you and Olga, but it's really to do our part getting vaccinated and to wear masks, especially in kind of settings indoors, just to create that layer of protection, one that the whole world needs, but more than ever, we need it now.
Thank you. And Dr. Nayyar, your comments.
Sure. Well, first of all, Dr. Zinner, thanks so much for having me. Thank you to the PBS team for continuing to do these town halls. I think we absolutely need to clear the air. I like to talk to my patients in really simple language because this is a really confusing time. And I like to compare what we're seeing with the Delta variants to a football game. And it truly is us versus them, right? We're playing the variants. And those of us that are vaccinated, you know, we've got the protective pads. We've got those big shoulder pads on. We've got our protective gear. And if you're smart, you're still wearing a mask, which is your helmet. For those folks who still haven't gotten vaccinated, are not wearing those protective pads, are in the game without a mask, without a helmet, they're more likely to get hurt, right? This is a contact sport. We're probably all going to get hurt at some point. But the thing folks need to understand if you're watching is that if you are not vaccinated and you are not wearing a mask, you're more likely to get severely injured, end up in the hospital or end up in the ICU. And that doesn't have to be the case, right? We've got all this gear. You just got to put it on. We got to work together. When you get injured, you hurt the whole team. We can't get to the end zone without the whole team. So we got to work together. That's really my kickoff here as we start the conversation.
Thank you, Geeta. You know, Olga, let's turn to some of the questions we get from the audience. Olga?
And as we speak, we're getting lots of them, Dr. Zinner. We've got a bunch on booster shots. Let me start with Andrea. She wants to know when they'll be available for everyone, and if she should get the booster from the same vaccine manufacturer that gave her the other shots as well. Great question. Dr. Zinner, let me also add, we got a number of questions about boosters. Should a person on dialysis 3 days per week get a booster shot? And one more I want to throw in here. Can antibody tests tell whether someone needs a booster shot? Dr. Zinner?
Well, let me answer the question about antibody testing. So antibody testing is something we can do, but it's not recommended by the CDC to make clinical decisions on. So we're not using that for clinical decision making yet. But as to the other issues, as for booster questions, let me also turn to Dr. Fauci. We had an earlier conversation with him, as I indicated. Let's take a look at what he has to say.
The current vaccines right now, when you think in terms of protection from serious disease that might lead to hospitalization or deaths, still do very well. But we are seeing data, particularly from Israel, which is about, a few weeks to a month or so ahead of us in the dynamics of this outbreak and in the implementation of vaccines. They're starting to see, even in vaccinated people with this Delta variant, more and more people, particularly the elderly and those who are in nursing homes and in extended care facilities, are having an uptick in some of the hospitalizations. So for that reason, what has happened is that we are putting together a plan that will likely be implemented sometime in September to make booster shots available. By booster, we mean a third shot if you've had a 2-shot regimen, essentially for everyone, but particularly concentrating temporally in getting it rolled out with the people who originally got the shots earlier, the healthcare providers, the elderly, those in nursing homes. And the reason that plan is being implemented is because we want to stay ahead of the curve. We use that analogy that Wayne Gretzky used to say, you want to skate where the puck is going to be, not where the puck is. So we want to anticipate that if, in fact, we do see a diminution in protection against hospitalization and or serious illness that could lead to death, that we want to be prepared to give the extra level of protection with a boost to people so that you can increase dramatically their immune response. In fact, in studies that have been done and are continuing to be conducted, we know that a third shot after several months of an interval after your second shot, and it's important because you give the immune system a chance to mature and make it more amenable to getting that extra kick from a boost, that you can increase protection really much, much better when you think in terms of antibody responses and other measurable immune responses. That's the rationale for planning and implementing ultimately the capability of giving booster shots to individuals.
So at this point, do we know whether it'll make a difference if you had the Pfizer shot and then get a Moderna shot, or vice versa? Or does it have to be the same one that you had earlier?
We would like very much for it to be the same one you had earlier, but there are studies now called mix and match studies, which are trying to determine, is the safety and the actual adequacy of the response the same if you use the same or a different one. We'll get that information pretty soon. But to the extent possible, we would like people to stick with what the original vaccine was.
Wow. Okay. A lot packaged in there. Let me again go to the panel. Let's start with Carlos again. I know you've got experience here as being one of the investigators in the vaccine clinical trial. Any thoughts on what Dr. Fauci was talking about?
Well, again, I think that Dr. Fauci said what we all are concerned about, which is that, I'm really worried about our immunocompromised individuals. And I think it's absolutely right. When we've seen hospitalized patients who have been vaccinated, we're seeing people who are transplant recipients. We're seeing people who have severe immunodeficiency because, for example, they received a disease-modifying agent like a CD4 antibody, something like that. But in general, people like me are not in the hospital. However, I have seen the data showing a decrease in neutralizing antibody response over time in people that have been vaccinated after 6 to 8 months. But, and we can certainly boost that response, but I'm not sure we have seen data showing that makes a clinical difference. So my concern is, Mike, to be honest with you, is while we're giving a third shot to people who already received 2 shots, like me or you or most of us, I think, we'll be taking over resources that could be used to give people the first shot. And what I tell people is the most important booster that I need is for the 93 million Americans that haven't been vaccinated to be vaccinated. Because if we all vaccinated, we can stop transmission of this virus. This is not just about individual protection. This is about community protection. So I am worried that if by giving boosters, we may be overcrowding those facilities and those healthcare providers that are needed to provide the shots to the people that currently are not vaccinated and who are going to be vaccinated because vaccine mandates are going to make people take the vaccine sooner or later. As far as which vaccine to take, I hear what Dr. Fauci says. You want to get the one that you're likely to receive, but I have absolutely zero data to support that. And in fact, the data suggests the opposite. From Europe, we have data that if you get a AstraZeneca vaccine followed by a Pfizer vaccine, you actually get a much better immune response. So quite frankly, why not? Why not give me a Johnson & Johnson vaccine? I may get an even better response. The reality is we are navigating right now in a data-free zone. And I want to emphasize that to people. We have no data to say the things we're currently saying.
Wow. Dr. Patel, Kavita, your comments.
Yeah, how do you follow that? Carlos he's both correct and I think also, I don't want to say incorrect in his logic and reasoning, but incorrect in kind of understanding what I think is happening in the psychology of the country. So I'll be brief. I think there's clear evidence to illustrate that immunity is decreasing over time. I think the critical question is, well, what level of immunity is enough to prevent what we really developed the vaccines for, what Dr. Del Rio was an investigator for, which is to prevent severe hospitalization and death. I think we miscommunicated from the beginning that the vaccine would prevent you from getting an infection. It was just hard to communicate that. So when we started seeing breakthrough infections, mostly mild, I think, to be candid, the CDC made a misstep in not requiring that to be reported, because already you felt like there was a blind spot. And then now we hear, and I've been trying, I'm sure Dr. Del Rio has, I've been trying to unpack the Israeli data that was mentioned several times, There's also the MMWR reports. And to just break it down for viewers, what it tells us is exactly what both Carlos and Tony Fauci have said, that we are seeing an uptick, and it is in long-term care facilities and in nursing homes. Well, you know what's hard to say about that, Mike? So look, I'm going to come out on the side of, I do want to see boosters, especially in immunocompromised individuals. I also take care of nursing home patients, especially in, I would even go so far as to say, certain age categories and high risk workers, which include healthcare workers, which include police, firefighters, EMS, et cetera. I think that is a very different population than the average community population. But every time we've asked our country to kind of do nuance or assess risk that way, Mike, we've failed. So what I want to avoid is kind of a failure of communication. Our vaccines work. They work incredibly well. In fact, they work so well that, you know, we could argue that yes, the mRNA vaccines and maybe 2 doses of a Johnson & Johnson might be the most superior protection in the entire world. The question, though, with boosters, now that we're going to start releasing them on September 20th, and by the way, you know, a lot has to happen for that to happen on that date, by the way. Right. The question to ask is, well, what do we need to do until then? And I, for one, am desperate because we have 6 to 8 weeks of schools that have opened and are opening. And we're watching children's cases, because they're an exposed population, increasing, 2% hospitalization, holding its own. But Mike, I think, you know, we'll get to viewers' questions. I think this is why you can see there are sometimes more questions than answers.
Got it. Appreciated that, Kavita. Geeta.
So, Dr. Zinner, gosh, we've got a lot of information here between Dr. Fauci, Dr. Del Rio, and Dr. Patel. I'm going to actually zoom out for a second. I want our viewers to understand the difference between the immune system in an immunocompromised patient, such as the ones that I see in rheumatology, and an immunocompetent, meaning a normal, healthy, able-bodied immune system. I'm going to go back to football, right? So immunocompetent, strong immune system. Your football team is made of a bunch of Tom Brady's, right? Immunocompromised. These were my patients: rheumatoid arthritis, lupus, psoriatic arthritis, right? These individuals have more Popeye the Sailor Man football players, right? Scrawnier, shorter. Those players need a boost, right? The concept here is that because your football team is a little bit scrawnier, you're more predisposed not just to COVID-19, but any infection, right? You're more likely to get sicker, to be hospitalized. So the concept that Dr. Fauci is talking about is, look, we think that these patients need a boost. They need that spinach. They need Popeye to build those muscles and go, 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 right? And Tom Brady, he gets tired too, but he's got a little more time, right? So according to recommendations now, it's about 8 months for the general population and much sooner for those that are immunocompromised. So that's really, you know, what we're debating here, just for the audience to understand. And look, this continues to be our first pandemic. Dr. Patel, Dr. Del Rio have clearly, you know, shown us that there is debate in the medical community, and there will continue to be, because we continue to drive the car as we're building it. But going back to the fundamentals and the basics of science are going to also be important as we weigh some of these decisions without the data, to Dr. Del Rio's point.
Thank you all. Very helpful. Listen, let me go back to Olga as we get some questions from our audience.
Thank you, Dr. Zinner. Lots of questions coming in. I just got this one from Tony that I'd like to read. And he writes, can I reinfect someone who has already had COVID with Delta if I have it? Dr. Zinner?
Well, I'm going to ask Dr. Del Rio. Carlos, can you answer that question specifically?
You know, it's very hard. Again, my answer would maybe it's possible. But the reality is, if you're vaccinated and the other person is vaccinated, the possibility of you getting infected and the possibility of you infecting another person is really, really small. The big concern, the reality is why I, as a vaccinated person, wear a mask indoors, quite frankly, is to protect the unvaccinated people, is to protect all those that have not been vaccinated because they don't want to or because they can't, for example, young children. But really, the other vaccinated people are actually fairly well protected. And we need to emphasize that. You know, I think we're getting into a minutia that it's too delicate. We're really concerned about the little bumps in the car, when the reality is the big accident out there is the people who are unvaccinated. We need to get people vaccinated as soon as we can. That is the key to our strategy to get out of this pandemic.
Great response. I totally agree with that. That the issue is vaccination to get out of this. Let me turn it back to Olga. We've got other questions coming in from our audience.
Thank you, Dr. Zinner. Maya wants to know what we're seeing from pediatric studies. Look at her question. Will vaccines be recommended for younger children and toddlers? And a few other viewers wrote in, and let me read Dr. Zinner. They want to know the effect of the Delta variant on children. Dr. Zinner, let me toss it back to you.
Well, first of all, thanks, Maya. I asked Dr. Fauci about children and vaccines earlier, and let's hear also what he has to say, and we'll get some reactions from our panelists also. Last year, we heard children had a very low chance of getting infected or getting sick, but now our children's hospitals are beginning to fill up with cases. What's the difference, and how do you think we should plan on protecting these children?
Well, it gets back to what I just mentioned to you about the Delta variant. The Delta variant is highly, highly transmissible. We've seen that in adults and we've seen that in children. And the more children that get infected, purely from a quantitative standpoint, even though it is true that children have a less of a chance of getting severe disease than does an adult or someone with an underlying condition. But you are absolutely correct. We are seeing more and more children, literally on a quantitative basis, requiring hospitalization and getting serious illness. And for that reason, we want to do the following. First, when you think in terms of school, we want to make sure we surround the children by people who are vaccinated, who are eligible to be vaccinated, teachers, personnel who are involved in the school system. For those children 12 years old and older who are eligible to be vaccinated, we want to encourage them very strongly to get vaccinated. For those children who not yet are eligible, and the studies are being done to determine if it is safe to do that and the kind of response and what dose they should get, that's the reason why we want to make sure we get people masked in the school system to protect the children and to allow them to safely get back to an in-person learning, because we know of the deleterious effects of keeping children physically out of school, mental health, developmental issues, and others.
Kavita, I know you're a practicing primary care physician in the DC area, and this is such an important question as many children are going back to school right now. Let me get your thoughts on it, Kavita.
Yeah, it's interesting. We are in kind of a relatively higher vaccination rate than other parts of the country. We're also kind of flipped into what would be considered by the CDC as high transmission based on our numbers of cases. So most of our schools are opening, have opened, or will open in the next week. And already I think you're seeing a scrambling in a pretty mask kind of friendly environment. Mike, you're already seeing a lot of concern from teachers, from parents, even from students who are pretty savvy. I think we kind of undermine how much kids actually understand. And they're kind of scared when they see what's playing out on the media about, kind of scary numbers and quarantine. So I do think that children, by the way, if anything, it's back to Carlos's point. If anything COVID has taught me is that if I think I know something, I'm totally wrong. So I'm not going to kind of get arrogant enough to say we know everything about Delta variant on children, other than the heightened infectiousness, the ability for even toddlers to transmit or have enough of the virus in their nasal passages and respiratory tracts. And that's a warning sign. That just means that, we are at a stage where we had higher transmission than when we actually moved most schools to virtual learning. So this is our obligation. I'm going to steal from Carlos kind of what he said about, vaccinating the world and trying to have that be our best line of defense. This is the best line of defense we can get for our children. Anybody watching, listening, if you know somebody who's not vaccinated, don't judge them. Spend time and try to appeal to the elderly family members in their life, children, grandchildren. And instead of running to think about when you need to get your booster or what date you need to get your booster, think about how you can send a message to all the people that are unvaccinated around you. So I'm very worried that coming out of this, and Mike, I think you and I have talked about this, hospitalizations and deaths kind of lag. We also know that we just aren't reporting data from the hospitals in the states the way we would like to. So we could very well see a darker picture with children, and I hope we don't get there. We can prevent it.
You're so right, Kavita. And I listen to some of the other media aspects that we listen to, or some of the social media, who complain about us in science changing our opinions. The fact is, we're learning as we're going. We've never seen anything like this before. So it's such an unfair criticism to say, well, last week or 6 weeks ago, you recommended this, and now 6 weeks later, you're recommending something else. This is something we've never seen before, and it's going to change again. That's the bottom line. We all know that. All right, let me go back to Olga. She's got some more questions coming from the audience.
Thank you, Dr. Zinner. I have a question here from Fatima that I hear a lot, and this is what she asks. Why do we have to wear masks if we are fully vaccinated? Dr. Zinner?
Okay, let's talk about masks. Geeta, I know there are different kinds of masks, and can you share your thoughts on what those are and whether children should be wearing masks and what kind of masks?
Sure. So I'm happy to add some color, and I'm going to tell you a little bit about what I tell my patients and also how I talk to my 9-year-old, because very similar to Kavita, I'm a mom of a 9-year-old here in South Florida where numbers are not looking very good, right? So number one, trying to decide what mask to wear, go to the CDC website. They have very clear guidelines, but the reality when it comes to especially children, the best mask is the mask that kids will wear, and the best mask that you as an adult can tolerate. So that's number one. A mask is way better than no mask. Don't get hung up on it. We don't want to see the mask around your chin. We don't want to see it around your, dropping down from your nose. You've got to wear it, and you've got to wear it correctly. That is the most important thing. The second thing is really counseling your children. So I'll tell you the discussion I had with Sonia before going back to school. Look, the original virus, if he was a superhero, he'd be Clark Kent, right? The Delta variant is Superman. He's faster. He's more transmissible, flying from nose to nose, right? That's the nasopharynx, and that's what you hear when we talk about this being more transmissible and more contagious. So really important to counsel your kids. For any kids watching, this is why it's important to wear your mask. And the danger zones when it comes to going back to school is when you're eating lunch or out on the playground. So counsel your kids on taking their mask off. If they get sweaty, if they get acne, do it away from other children. Eat lunch outside, drink outside when you're taking a snack break, to the best of the school's ability, to the best of the child's ability. But we discount our children's ability to understand, as well as just counseling them on wearing the mask. The second thing that's really important too, going back to that football analogy. So remember that protective gear, children under 12, the only protective gear that comes in their size is a mask. They don't have those big shoulder pads. They don't come in the sizes under 12 years old. So everyone around them has to protect children under 12, like they're the quarterback, right? All of us that are vaccinated with all our gear on, our helmet, our protective shield, our vaccines, our mask, you're wearing it for them. You're wearing it to protect the children and those that are vulnerable among us, because it's the only way we win this game and end the game. So we've got to do our part. We've got to help everyone. The mask is one more protective gear on top of everything you're doing by being vaccinated.
Great. Thank you. Olga, let's go back to questions from the audience.
Thank you, Dr. Zinner. This question comes from someone that did not put a name, but it's a great question, and let's show you what it is. My husband and I are trying to become pregnant, and I'm concerned about whether the vaccine could harm my fertility. Please help me out here. And I really do believe this is an extremely common question. I even had some issues with my 2 teenage daughters to get vaccinated. They were very concerned about how that would affect their fertility down the road. So I'm really glad this question came in. Dr. Zinner.
Olga, I probably hear this question at work more often than almost any other question I get about fertility. And it's not going to go away. And part of that is because many of us work in an environment where there are young women who are of childbearing age. So let's try to clear the air on this. I'd like each one of the panelists to give me your thoughts. Geeta, let me start with you, and then we'll go to Kavita and then Carlos. Geeta?
Sure. So let's clear the air, Mike. So number one, as a mom, as a woman of childbearing age, hear it loud and clear. The vaccine does not affect fertility, period, end of story. And by not getting vaccinated, you are more likely to get COVID-19, more likely to end up sick in the ICU, getting hospitalized, believe me, that will impact your family planning way more than thinking about getting vaccinated. Talk to your OBGYN. They're going to tell you the same thing. This is not an issue to be concerned with.
Kavita?
Yeah, I'll just add to that the CDC recently released some updated guidance, and it was based on data, kind of what I'd call real world evidence from over 103,000 women who kind of went forward and submitted data on their vaccination, fertility, pregnancy status. First of all, with fertility, we also think about miscarriages. There were no differences in terms of vaccinated people having more miscarriages. And in fact, we now know that with COVID infections, there can be a higher risk for preterm labor and some bad outcomes for the mom and baby. With respect to fertility, there have also been across the world several studies that have been looking at now. If you think about it, Mike, we've had billions of people receiving vaccines. So we really do have not just the trial data, but growing evidence. No differences and no effect on fertility. There's a lot of bad rumors that my patients have found on Facebook, WhatsApp about changing their ovarian cells. There's no proof of that. These are not vaccines that interfere with your DNA. That's another reason people think it affects fertility. And then I'll just say for men, we do know, again, that COVID can potentially have outcomes on your sperm count and other factors for fertility. So I know many young men have been worried about this as well. They should ask these questions. So far, I would say, and I like to get reminded by some of the vaccine experts, we've got one next, that if you were going to see some of these outcomes, you would also generally see them in the weeks following vaccination, which is why it was really important for the CDC to conduct their registry and also for other countries to share their data. So hopefully we can dispel a very valid concern amongst men and women.
And Carlos?
Well, I would just say that I totally agree with what has been said so far. But I would say that this idea that the vaccines affect fertility is fake news. It's totally misinformation that has been disseminated by people. This is absolutely wrong. And I'll give you two pieces of information besides everything that has been said. Number one, there's a paper published in JAMA showing very nicely in men who were vaccinated, there's absolutely no decrease in the sperm count. You see the same level of sperm motility and numbers of sperm. And number two, I'll just give you an anecdote. As an investigator in the Moderna study, while we did not enroll women who were pregnant, some of the participants that we enrolled were women of reproductive age who got pregnant during the study. And I can tell you that more women got pregnant on the vaccine arm than the placebo arm. So maybe the vaccine actually increases your fertility. I don't think it decreases it.
Well, I'm going to take that as a re-emphasis point. Let me make that point one more time. There is no evidence that the vaccines interfere with fertility or even pregnancy. And that, unfortunately, that myth is out there and it's wrong. Anyway, let's move on. Olga, let me go back to you.
Thank you, Dr. Zinner. Statistics continue to show that people from underserved communities, especially Black and Brown communities, are not getting vaccinated. So we asked a local community pediatrician to talk about why they are so reluctant. Let's take a listen.
So there's two problems. There's number one, reading the wrong information, misinformation, which we're all familiar with today in this day and age, misinformation that's spreading like wildfire. And then two, not really having a reliable source that you trust, or reliable person or person in your community that you can trust and that you can get advice from. I have found personally that I would speak to my patients and their families about the vaccine. Literally, the parents would tell me, I do not want to get vaccinated. And in the 10 minutes that we're together in the room, I've been able to change their mind and they've gone and gotten vaccinated right after our conversation. And that makes me feel great because that means that they trust me and they value what I'm saying. I never tell them that it's my opinion. I never tell them what I think they should do. I just give them the facts.
Well, thanks, Olga. I also spoke to Dr. Fauci about this very topic, and let's take a look at his comments. Underserved populations continue to have a lower vaccination rate. And what are you doing to help these communities?
Well, we are doing a lot. We're getting surge teams out to help with the logistics of getting vaccines to people. But we also are intensifying our work with the community core, namely getting trusted messengers that people of color trust and know. They could be clergy people, they could be family physicians and healthcare providers, they can be peers, they can be sports figures, people who at the really in the trenches level can be in the community and be the trusted messenger to get people of color to be vaccinated for so many reasons, particularly because they are suffering, unfortunately, disproportionately when they do get infected, of getting more severe disease for a variety of reasons, including many of the social determinants of health that provide them, unfortunately, with getting the environment to get more severe types of underlying conditions: hypertension, diabetes, obesity, chronic lung disease, kidney disease, and things like that.
One of the other lessons we've learned from the underserved community is access, and that some of them don't have transportation and are either homebound or housebound. And we've begun to move those kind of vaccination opportunities to them. I've learned from that lesson. And in fact, at my institution, we've got 1,700 employees, and some of them didn't get vaccinated. And what we discovered is if we have a mobile cart, a vaccine cart that would go floor to floor or department to department, we actually increase the vaccination rate. It's the kind of thing we need to be and doing in our communities, even outside of my hospital environment. All right, look, Olga, let's go to the next question.
All right, Dr. Zinner, thank you. Our next question comes from Helen, and this is what she writes. I've had 3 separate cancer incidents, and I'm not currently under any treatment right now. She wants to know, am I considered a person with a weakened immune system and therefore a candidate for an extra dose of the vaccine? There's her question right there, Dr. Zinner.
Okay, thanks, Olga. I'm going to take this question. We've made some decisions at the Miami Cancer Institute to follow the CDC guidelines and give boosters to cancer patients under active treatment. And those would be those that we think are immunocompromised, but not to give to those who simply have a history of cancer, particularly if we think that they are in remission and they're doing well. They may fall under the category that Dr. Del Rio and Dr. Fauci talked about, that's coming up in September, that may be age-related and or other disease-related. But right now, we're focusing on patients that are under active cancer treatment. Olga, next question.
All right, doctor, let me take this question from Raj, and this is what he's asking. Is herd immunity a possibility with COVID-19? Dr. Zinner?
You know, Carlos, I want to turn this one to you. This seems to be a moving target because the numbers we heard earlier in the year and the numbers we're hearing now may be different. Can you enlighten us on this, please?
Well, Mike, I think what was said before is that we are now sort of, teaching science through television, right? We're teaching science to the community, and herd immunity is a very complicated concept. I like the term, instead of herd immunity, I like the term community immunity. And the community immunity, the level of disease, people who either have suffered a disease, have been infected, or have been vaccinated, is determined by what we call the R0, the transmission rate of a virus. So the original Wuhan strain had an R0 about 2.5, which means 2.5 individuals. Every one individual infected infects 2.5 individuals. 2.5 individuals infect 2.5. So in a naive population, at the end of 10 cycles of transmission, you had about 9,000 people infected. R0, the herd immunity is determined by the R0. So with an R0 of 2.5, your herd immunity threshold is about 60%. With the Delta variant, we think the R0 is somewhere around 6. When you get an R0 of 6, then one individual infects 6 infect each one 6, et cetera, et cetera. At the end of 10 cycles of transmission, you have 30 million people infected. That's the difference with Delta. But what that does to the R0 is that the R0 now, it's over not 85%. It's close to 87%. And what that means essentially, in my mind, is that you're not going to be able to get to herd immunity. Because unless you really cover 100% of your population with vaccines, and that is the challenge, is that at this point in time, eradication of this disease is going to be virtually impossible. The best we can hope for is mitigation and decreasing the transmission to a level that is manageable in your hospital, in my hospital, and the mortality are available, are in a manageable range. So the reality is, at this point in time with Delta, I think herd immunity is really a far-reaching concept.
Wow, Carlos, that's a lot to unpack also. Thank you. Let me turn this back to Olga.
Dr. Zinner, great question here from Mary, and this is what she writes. Is the Moderna vaccine better than Pfizer vaccine when it comes to the Delta variant? Dr. Zinner?
That's an interesting topic that's come up in part because of what's in the press. And Kavita, let me turn that one over to you. What are your thoughts on that? What does the data look like on that one?
Yeah, so I'll just say this, that the data hasn't been peer reviewed. So there's a study, and there are several, but since we've got a Moderna clinical trial investigator with us, I'll just say that one of the studies that was released without peer review publication, but was mentioned by Dr. Fauci, Dr. Walensky, and did make its way through the press, illustrated that when they followed people who received Moderna, as well as people who had received Pfizer kind of in cohorts, meaning they tried to find people who got it in January and see how their effectiveness changed over time, they found that Moderna seemed to decrease its efficacy at a lower rate than Pfizer, or simply put, the headline that was taken away was that Moderna was somehow better than Pfizer. There are many issues to take with that, including the fact that they did not actually see that both vaccines worked incredibly well in preventing death and hospitalization, kind of a theme you're going to hear us say over and over, which leads to the conversation of, even if there is decreasing efficacy, there is no data to support that one mRNA vaccine is somehow superior to the other. There are also a lot of speculations that maybe Moderna, because it was administered 4 weeks apart, versus Pfizer, which was 3 weeks apart for its 2 doses, might have been a better combination. But again, I think this is where we're kind of getting, I am going to just, it feels easier if I just steal Carlos's phrases, but if we can just avoid the minutia and you go back to the question, there is no reason to think that any one of our current 3 vaccines can't protect us against what we really want it to do. I think that's where I received Moderna very proudly, and I have colleagues who work right by my side who received Pfizer, and I don't lose any sleep over whether one of us had something better than the other. They're both the same technologies. They both approach the immune system the same way, different doses per se, but not a change that I would dwell on. And I will say the same thing. The best vaccine, kind of like the best mask, is the one that you'll actually get. So don't just get dose 1 of anything, make sure you get both. And if that means Johnson & Johnson's a better fit for you, then that's a great option too.
And if I recall from that preprint also, that one of the, not headlines, but takeaways was that even though there may be some difference in terms of effectiveness over time, there was no difference in hospitalization rates in either one of those 2 vaccines.
Right, or death.
And that was somehow missed. That was somehow missed in the press.
Sure, and I'll say it again. I've never seen so many we go through a process in science of having our peers review what we do, because first of all, these types of studies aren't considered as good as the kind of study Dr. Del Rio had to do for his trial. But I understand why people want to know that answer. But hopefully that offers the questioner some comfort that there have been so many of us vaccinated with both, and we have not seen any differences in some of the real world data from around the world.
Okay, good. Let me go back to Olga. She's got another question from the audience.
I do, Dr. Zinner, and this one comes from Bill, and he writes, please discuss the known variants such as Lambda. Are they going to get traction in the U.S.? How dangerous are they? Dr. Zinner?
I'm going to turn back to you, Carlos. That's sort of right up your alley, having been in that vaccine field and watched that trial over time. So, Carlos, your thoughts?
Well, again, I think it was said at the beginning of our talk today that as long as viruses are transmitting, they're mutating and they're producing new variants. And the Lambda variant has emerged in Peru. And could it be here? Absolutely. But, I'm not going to worry about the future, because the reality is I'm concerned about right now. We need to control the Delta variant, And again, if we stop transmission of the virus, we're going to stop mutations and variants. Variants happen when the virus is transmitting in an uncontrolled way. If we can stop that transmission, we're going to be in good shape. Now, I'm going to tell you also that many of the pharmaceutical companies, Moderna, Pfizer, the producing vaccines, are also working right now on what we call pan-coronavirus vaccines. And I think the future is going to be a pan-coronavirus vaccine. In other words, it's going to be a vaccine that no matter which variant you have, no matter which strain of coronavirus you have, it's not only SARS-CoV, but it's going to be MERS, it's going to be the original SARS, you're going to be protected. So again, this is evolving very rapidly, but at the end of the day, the investments that we as Americans have made in science are actually paying off. We will be out of this in great part because science is helping us.
Great comment. I want to turn this back to Olga. We're coming near the end of our hour.
We are, Dr. Zinner, and I'm going to actually end with this question from Mary Jane. It is a question that I think everyone has asked up to this point, and she wants to know, when will this nightmare end? Dr. Zinner.
This is one I need comments from all three of our panelists. Let's start with Dr. Del Rio, and then Dr. Patel, and then Dr. Nayyar.
Well, I will start by saying that this will end. Pandemics end, but they end not when we decide it's going to end. I would say that President Biden made a mistake, quite frankly, by saying July 4th is our independence from COVID day. You don't make that decision. The virus makes that decision. The immune system makes that decision. So what we need to do is do the right thing. I know we're all anxious. We're all, tired of this. I'm tired of this, but we also need to just, plow along, do the best thing we can. And, I would implore people to have compassion, to have kindness, but more importantly, to think about yourself, to think about your loved ones, and to think about everybody else. Because that was, as Geeta said before, if we all do the right thing, if we all wear our army of protection, if we all take our vaccines, if we all wear our mask, we will control this infection. It is up to us. It is not up to anybody else. It is up to us to control this disease. And we will be able to do it. I am confident that this will be over, and this will be over when we all decide that it's time to have it over.
Kavita?
November 20th, 2020. That's when this ended for me. And I may have gotten the exact date wrong. That's when Pfizer filed their emergency use authorization. And we saw some of the top line data that had that dramatic 96% efficacy. I truly cried that morning. It's amazing to think that science, we knew these trials were happening. We had no idea what the outcome would be. And so that really was, to me, an incredible inflection point, and one that people should really have optimism. If you had said to me in January and December 2019, when we saw these reports coming out of Wuhan, that in under a year, we would have not one, not two, but almost 3 highly effective vaccines, and in abundant supply to our country, I wouldn't have believed you. I truly would have thought that was fake news. So I'll be honest, Mike, for me, that moment of clarity was November 2020, which just shows you how much we have, because that's from then to now, that's precious time. We could have preserved lives that we lost. So think about your loved ones. Think about doing it for them.
And Geeta, we only have a few minutes.
Sure. So Mary Jane, great question. I think we're all asking ourselves the same. My 9-year-old certainly asked me that on her way to school this morning. So the important thing to recognize is that the Delta variant has changed the game. It's no longer about if you will get exposed to the variant or the virus, but it's really a question of when. So putting on that protective gear, putting on those shoulder pads, putting on that vaccine is key. Second, keeping a helmet on, wearing that mask is critical. It's also really important to ask the experts, such as the ones on this panel, attend things like this town hall, right? Getting the right information is really important. You don't go to your mechanic for a haircut, right? So for healthcare, you need to talk to your doctor, no one else. For those that don't have a doctor, look for one. For folks who have issues around access, please remember there are free clinics, such as the one at the University of Miami where I practice. There are federally qualified health centers. There's telemedicine. There's an opportunity to find a physician 24/7 online. And there's your pharmacist. Your pharmacist is a terrific person to ask questions to. And lastly, remember that your physician doesn't make any money if you get vaccinated or not. We are not running for re-election. This is not about freedom. This is about survival. And for those who feel like there's no hope, there is a lot of hope. We've made tremendous progress, as Dr. Patel mentioned. This pandemic ends with you and me. You are the MVP. You are the most valuable player here.
Geeta,
So let's make it happen.
I have to ask you, I apologize, but we are absolutely running out of time. I want to thank our panelists. This has been an incredible evening. And if we thank them all, please say thank you to them. And remember, this is about your health and your care. And if you take anything away, ask the experts about the opinions raised tonight. Thank you all. Olga?
Thank you, Dr. Zinner. And of course, we thank you for joining us right here on the Health Channel. Please stay safe and have a good evening.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.